Good afternoon, it's Dr. Matthews, and we're going to talk about infections of the cardiovascular and circulatory system. Okay, endocarditis is the first thing we're going to talk about, and it's inflammation of the endocardium, which is the lining of the heart and the heart valves. And symptoms include fatigue, weakness, fever, chills, weight loss, blood in the urine, muscle aches and pains. And the treatment varies depending on what it is. It could be bacterial, but it could also be fungal. Just when we look at the inside of the heart, this is cut in half, you can see on the right side, you can see your tricuspid, and on the left, you can see your mitral, between the left atrium and the left ventricle, and then going out to the aorta is your aortic semilunar valve, and I don't see your pulmonary valve marked, drawn on here. It's the way they have it drawn. But if you have an infection in this aortic valve and it has vegetations on it, it means glops of bacteria, they're going to break loose and they're going to go out this aorta. Now, where does this go? Everywhere, right? So bacteria pieces are going to go to and fro and infect different things. Endocarditis can start out relatively mild. The clumps break off the valve, and they could cause a problem in your left arm one day and your right leg another day. Eventually the valves quit working and you either die from heart failure or from damage from the bacteria. So this is something you hope one could diagnose, and it's a little strange that it can be mild to start with and people don't know they have it. Myocarditis is inflammation of the muscular part of the heart, or the myocardium. That's one of the big things that we talk about with COVID. It definitely causes myocarditis. It can also be caused by parasitic infections. Results in heart failure, chest pain, fever, shortness of breath, swelling of legs because you're getting heart failure, arrhythmias, congestive heart failure, and death in general. Pericarditis is inflammation of the pericardium, which is a sac around the heart. This is usually a complication of a viral infection. Symptoms are going to be chest pain, breathing difficulty, especially when reclining, dry cough, anxiety, probably because you can't breathe, fatigue, and fever. And these certainly need to be diagnosed because eventually it will just squish your heart tighter and tighter, and it can kill you. Bloodborne infectious diseases. These are ones that are spread by bodily fluids or blood, and these are of great concern to people who are in healthcare, emergency response, public safety, and teaching, unless it's online. Pathogens of great concern: HIV, hepatitis B. You should be vaccinated for that. Hepatitis C, in any of those causing viral hemorrhagic fever. Things like Ebola. You don't want to get Ebola blood on you. Microbemia is infections that are caused by microbes to enter the circulatory system through the lymphatic drainage. So the lymphatic drainage is trying to filter those germs out, take them through the lymph nodes, but they just don't totally get it. They may be asymptomatic, symptomatic, transient, and then it goes away, continuous, or intermittent. Fever, chills, rigors, sweating, malaise, fatigue. It has to be treated with antibiotics. Septicemia is a toxic condition spread by bacteria or bacterial toxins from site of infection. This is a medical emergency, and the patient is going to die if something is not done about it. They just absolutely will die. Progresses to septic shock, death, as high as 50% death rate. May start out as loss of appetite, fever, chills, accelerated breathing, heart rate is accelerated, they're lethargic, they have agitated behavior. I remember hearing about a woman who was lived in south of Thomaston somewhere, and she was on high levels of Oxycontin. She found an illegal source and was getting them and taking them daily, and she just didn't feel any pain. And she had an infected, ingrown toenail that she stumped into the wall, and it got worse infected. And she didn't feel any pain. She felt fine. Her husband came home from work, and she was laying flat out on the floor. Of course, he called an ambulance. They took her up to Thomaston. Life flighted her out to Grady, and she died. She was severely septic, had probably been septic for days, and didn't notice because of the drugs. It was a very, very big emergency. Rheumatic fever is an inflammatory disease that can develop after group A streptococcal infection, and it involves heart, joints, brain, spinal cord, and skin, usually in children between 4 and 18. Symptoms: joint pain, fever, chest pain, carditis, rash, nodules under skin, and it's going to require long-term antibiotics and rest, limiting physical activity. Gangrene. Gangrene is the death of tissue, decay and death of tissue, due to, well, generally secondary to some sort of wound. Ischemia is restriction of blood supply is what causes it, and commonly infects the extremities. This is pretty typical and common in severe diabetics. They lose sensation to their toes and feet, and then they don't know that they also lose circulation, and they don't even notice it. You may have to remove, well, you will have to remove necrotic tissue, and antibiotics are not going to do it because tissue is dead and you can't bring it back to life. Now, to try to stop it from further spreading, hyperbaric oxygen therapy can be used, because the bacterium that become involved are generally anaerobic, which are going to be clostridial agents generally. Types: dry gangrene. This is just ischemia, no blood supply, distal portions of the limb. Internal gangrene, also called white gangrene. This is after surgery or trauma gone bad. Wet gangrene is organs lined by mucous membranes such as mouth, lower intestines, lungs, and cervix. Don't think if you have gangrene in your lungs you're going to fare very well. Then gas gangrene. You have already damaged tissue, like say a leg from a wreck or a injury of some sort. So you got horrendous crushing damage, low circulation. Then bacteria invades. It's a gas-producing bacteria. This is often Clostridium, usually clostridial organisms, because Clostridium, you remember, are anaerobic, and they don't like oxygen. They can't deal with oxygen. So they just love to grow in places that have decreased circulation. And gas gangrene is going to kill you very dead if it's not treated, and it may require amputations. This is dry gangrene. I can't even look at that long. That's just horrible. And those toes, pieces of them have got to go anyway. Okay, zoonotic bacterial infections. Zoonotic is something you get from animals, from a vertebrate animal. And there's over 200 that have been described. May be caused by bacteria. Now let's talk bacterial infections, but you can also get viral infections, parasites, and prions can cause a zoonosis. Potentially, it could be spread from person to person, especially through breastfeeding. It starts with flu-like symptoms, and it may persist for up to a year. But the reason it's called undulant fever, to undulate, is to go up and down and up and down and up and down. And you wake up in the morning and you feel fantastic. And then you have a fever of 104 by that afternoon. And then you feel fine that evening. And it just goes on and on and on and on. Swollen lymph nodes. I actually talked to a man once who is a dentist that had been on a mission trip to Africa to work with the Maasai warriors, and they'd never had dental care, so they worked on their teeth. Well, they don't tend to kill their cows and eat them. Their steers, they actually extract blood from them and make soup, and they know just how much to keep the animals alive. And then they milk them. They milk the cows that have babies. And they offered two things at the big shindig they had. And one was blood soup and one was some sort of milk product. Well, he drank the milk product. And he had been to infectious disease specialist after infectious disease specialist, but no one ever took the time to ask him about his history. Well, as soon as he said that to me, he drank raw milk in a foreign country with no disease control. I said, I bet you got brucellosis. He got tested, he had it, he got treated, he was fine. Tularemia is another interesting thing. Rabbit fever, Francisella tularensis. This is a gram-negative bacillus. It affects blood and lymph nodes, and it's carried generally by rabbits and squirrels. It can enter the body through a minor skin abrasion. Symptoms: fever, chills, headache, fatigue, dizziness, muscle aches, joint pain. And I actually had a student who missed a couple of weeks of school because he had tularemia from cleaning wildlife and he cut himself and he just got blood all in the wounds and kept going. I read one article where someone got it from running over a rabbit, and it aerosolized rabbit. If you do hunt rabbits and squirrels and eat them, and this is more common in rabbits, but either way, you should really wear gloves when you clean any kind of animal. For one thing, it's a lot less nasty and you don't get so much blood on you, but especially with the rabbits and squirrels, you don't want to get tularemia. Cat scratch disease, Bartonella henselae. This is transmitted by cat scratches or bites, or exposure to saliva, or contact with the eye. It's usually from kittens. They only transmit it for about 10 days or so. Symptoms: fever, fatigue, malaise, headache, and I don't know why they're not saying the swollen lymph nodes or one swollen lymph node. It's not spread from person to person. Rat bite fever, systemic infectious disease, developed after a bite or scratch by an infected rat or rodent. Or, this is a good one, ingestion of food or water contaminated by rat or rodent excreta. That means poo and urine. So, symptoms include abrupt onset of chills, fever, vomiting, pain in the back and joints, and headache. And look at this, fatal if untreated. So, would not think your pet rats are an issue if you have pet rats. And believe it or not, I've never kept pet rats, but I did work on them in the last veterinary clinic I was working in because I was the only veterinarian that was too proud to admit being scared of them. I actually found out they're really gentle. They don't bite you intentionally. They're pretty nice, but if you try to catch a wild one, it's probably where you're going to get bitten. Now hamsters will bite you. Okay, a vector is an animal that transmits an infectious disease. Flies, ticks, mites, fleas, and rats are some of them. Lice, we'll see as we come to later. Body lice also can transmit disease. But insects cause a lot of human mortality and morbidity because of the transmission of pathogens. Mosquito is probably the most dangerous animal in the world. It kills more people. Plague. Bubonic plague, septicemic, and pneumonic plague caused by Yersinia pestis. You get it either by being bitten by a flea that carries a bacterium that it got from an infected rodent, or from handling the infected rodent, or from handling a person who has plague, or a cat that died of plague. So bubonic, septicemic, pneumonic. Recovery will provide immunity. There are vaccines, but I don't think we're giving them here. There's just not much plague here. This is a lymph node that's swollen and burst. That's a buboes. Now, history, just a little tiny bit of history, and I found some references to it may have been as many as 5,000 years ago. There may have been instances of plague, but in the 1300s, so the 14th century, killed as many as 200 million people in Africa and Eurasia, killed as many as 60% of the European population. And there have been other times, there have been waves and waves when plague caused pandemics. But back when they were having these severe problems with plague, they had no germ theory of disease. Only superstition and blame. I read several articles before I wrote this one page, and it said they'd blamed it on a certain population of people, so they'd go kill them all. Well, if those people had plague, then they just got it themselves from being around them. Rocky Mountain spotted fever, Rickettsia rickettsii. Spread by ticks, fever, nausea, vomiting, headaches, muscle pain, lack of appetite. Characteristic rash, spotted rash, and it definitely requires antibiotic treatment, and you get some people are going to die of it regardless, up to 5%, even if they get aggressive treatment. And here's somebody that has a rash. This is supposed to be the rash, I think, here too. Lyme disease, Borrelia burgdorferi. It's transmitted by the black-legged tick. However, I've read scientific articles that it has been found in other ticks. If it's a tick, it's a tick. You need to get it off of you. And they need to stay on you for any of these tick-borne diseases. They need to stay on you for close to 24 hours to transmit the disease. So if you have ticks, if you've been in a place you could get ticks, go out, come in that evening and be sure you don't have ticks. Do a good inspection. Skin rash, I've got a picture on the next slide or two. Fever, headache, stiff neck, muscle pain. If you treat it at this early stage with antibiotics, it's cured. If you don't, it goes on to the joints, heart, nervous system, and severe arthritic attacks. Just a little bitty tick. See how small he is? This is a bullseye rash, typical of Lyme disease. And if you have that, you pretty much, and you've had a tick, really this patient should be put on antibiotics. because it takes 3 months to test positive for ticks, and by the time the 3 months has gone by, this is gone, they've got a really serious disease. So tick was there, you've got a rash that big, to me it would be malpractice not to treat it with antibiotics. Penicillins, tetracyclines work. Ehrlichiosis, reservoirs, deer and rodents, transmission, Lone Star tick, and fever, headache, malaise, muscle aches. Severe cases, you can get severe fever, renal failure, DIC, disseminated intravascular coagulation. That generally happens when you're in shock and just right about to die. Meningoencephalitis, respiratory distress, seizures, coma, and death. So if this is diagnosed, you need to start antibiotics immediately. We'll talk about several types of typhus. Epidemic typhus is caused by Rickettsia prowazekii, and it's transferred from person to person by body lice. Head lice are no respecter of social class. Anybody can get head lice. They can be clean, pretty people, and they can get head lice. Body lice are from laying in filth, and there's really no excuse in this day and time to have body lice. But that's how they're transmitted. And it was just totally typical back in, 200-300 years ago to have body lice because people didn't have a good way to stay clean. Headache, backache, joint pain, fever, nausea, vomiting, cough, abdominal pain. As high as 20 to 60% death rate. Endemic typhus is caused by Rickettsia typhi, transmitted by a rat flea. Similar symptoms, but not as severe. Scrub typhus, and this one I have never heard of until right now, and so it was interesting to me. Aurantia, and I'm not even going to try the species, but it's spread by chiggers. So I need to look into that one more closely, since I know I'm going to get chigger bit and every time I go outside practically. Relapsing fever, Borrelia recurrentis, spread by, again, body lice and ticks. Overcrowded people, poor hygiene, tick and louse-borne. There are tick-borne and there are louse-borne types. Treatment involves antibiotics. Infectious mononucleosis is caused by the Epstein-Barr virus, and it is a herpes virus, human herpes 4, and it causes sore throat, fever, fatigue, swollen lymph nodes big time. You can get swollen spleen or liver problems, and these can even get to the point of being extremely dangerous. The spleen could even rupture. Most people just get over it fine with rest for a few weeks. Some swap and spit, usually from kissing. Know of several people, one person who was absolutely germ paranoid, a microbiology teacher at Columbus State, and she got it. They thought she had leukemia, actually, and this is what they found out, it was mono, and the only thing she could come up with was she was filling her cup to drink out of the water fountain, and somebody had put that virus on, by putting their mouth on the water fountain, and she caught it that way. And then another thing where there was a school lunchroom that was not sanitizing their dishes properly. But that's usually it's from kissing, and they get over it, or from sharing drinks. Viral hemorrhagic fevers. These are fevers, febrile illnesses ranging from relatively mild to life-threatening, and transmission is from either handling infected animals, the remains, fecal matter, urine, or secretions. Fever, vascular system damage, bleeding, shock, and death. One examples, things like Ebola. This is like the biggest, baddest one of the hemorrhagic fevers. Very, very dangerous. And I remember reading several way back before everybody knew about Ebola about some people visiting their home village, and about 200 people, and then going away for a month and coming back and everyone had died. The whole village. It was a very, very terrible disease. Fungal infections, we've talked about local ones, we've talked about brain infections, but systemic mycoses are affecting all internal organs. This is generally going to be people who are immunocompromised. Now, if they're taking immunosuppressants, they may have to discontinue those temporarily until the fungus gets under control. And it just depends on the immune system status. If they have HIV and it's not responded to treatment, or they have cancer, or neutropenia, they've had an organ transplant. If you have an organ transplant and you quit taking your immune suppressing medications, that's going to kill you. So it's kind of in a bad situation. People who have had surgery for pancreatitis or splenectomy, or they have uncontrolled diabetes mellitus, just very old, very young. Any of these people, it can be a very serious and deadly prognosis with them. Protozoan infections present unique challenges. Once they reach the circulatory system, treatment is problematic due to drug therapies. Malaria is the most common vector-borne infectious disease, widespread in tropical and subtropical regions. And it actually used to be in Georgia. It was common, and I think they sprayed a bunch of DDT, but a lot of people died of malaria. It's gone now, but we've got the mosquitoes, and we could get it back. It's a lot more treatable than it used to be. Plasmodium species, there are several species. It has to be the specific type of mosquito, and also a blood transfusion or needle sharing. And it depends on your immune status on how bad you get it. The life cycle of malaria: a mosquito bites you, and she is infected with malaria, and the stage that she has inside her is a sporozoite, and she injects it in you, unintentionally when she bites you. Then the sporozoites invade the liver, and they undergo schizogony. And schizogony is that reproduction method where you have more and more and more nuclei and before you actually get cytokinesis, so you get many cells. Then those liver cells rupture, and what comes out of them are merozoites, and they go and infect red blood cells, and then they grow and grow and multiply. They produce gametes and reproduce, and then you get red blood cells bursting. The gametes are going to be ingested by the mosquito, and then the gametes mate and form the sporozoites, and round we go. Babesiosis is a vector-borne malaria-like illness, but it's transmitted by ticks. Infections may be asymptomatic or mild, or they may be very severe. High fever, chills, anemia, and antiviral drugs is what you treat them with. Toxoplasmosis. We've talked about toxoplasmosis in the nervous system section, but it's caused by Toxoplasma gondii, and only the cat is the only place that the reproductive cycle is complete in. Then it goes, the cat passes stools, and then an animal eats those stools, hopefully accidentally, and then it gets into their system, And that's the typical way that we end up getting it, is from eating raw or undercooked meat. It could get into the water. Could be directly fecal oral route. You eat cat turds. And why would you eat cat turds? Because you're yucky. You don't clean your cat box. If you have a dirty cat box, you need to feel guilty. The cat steps in the turds, climbs in the bed, puts his foot in your mouth. You know, what's he to do? He can't help it. So if you have a house cat, keep him immaculately clean for his health and yours. And also, if you're pregnant, mother to fetus, you can keep your house cat, but you've got to clean the litter pan every single day. Really, you should do a complete change every day. And wear gloves, use a scoop. Nobody's going to pick the turds out by hand. They make little scoops, and you can also wear a mask if you want to. People with organ transplants or blood transfusions could get toxoplasmosis. Usually you don't need treatment, but where you get the problem is if you're pregnant, the fetus could become infected and it could cause brain damage or blindness. And if you have an immunodeficiency like AIDS, it can go into your brain and kill you. This little toxoplasmosis organism, I believe that's what that's supposed to be there. Okay, American Trypanosomiasis, Chagas disease. Trypanosoma cruzi, we mentioned this in another chapter. Its insect vectors are found only in the Americas, primarily Latin America. 8 to 10 million people in Mexico, Central and South America are infected, 300,000 in the U.S. If you're not treated, it's a lifelong infection that can kill you. And there's an acute phase and a chronic phase. It's not going away without treatment. And there are anti-parasiticides for it. And you remember, you get it from getting bitten by the Dudavid bug. Leishmania, widespread complex disease caused by parasites of the genus Leishmania. It causes several forms: visceral, cutaneous, diffuse cutaneous, and mucocutaneous. Transmitted by female sandflies found in the tropics and in the Mediterranean. Treatment is available, but some species are drug resistant. So if you wanted to take that trip to the beautiful tropical islands somewhere or in the Mediterranean and have a great thing, and you can't afford it like me, or you're doing work like me, just think of Leishmania and you'll feel better about life.